invite now Manish Kohli. Manish Kohli is on the call here, and Manish was the ex-chairman of board of HIMSS, and he's been working a lot in the digitalization of the Middle East, and we want to bring him live to comment on actually how has he been seeing the change in the landscape and the ecosystem of the Middle East. And I forgot to say, actually, Manish has been a long collaborator of Health 2.0 Egypt. He came to Egypt twice for 2 of our events in less than 3 months. So thank you very much for that, Manish. And so I want you to comment, please, on how do you see the ecosystem changing and the digitalization efforts of the government changing in the Middle East in the past few years.
Good afternoon, good evening, guys. A wonderful panel. Pleasure to see familiar faces, and nice to meet you, Ali and Matthew. I think this is a renaissance moment in healthcare. I think, everybody has sort of woken up saying that, oh my gosh, we have to do things differently. And sometimes it takes an external threat really to shape the world that we live in. I think as I've seen, the Middle East evolve, you've seen a lot of hospitals achieve stage 6 and 7 from the HIMSS MRAM criteria. There's been a lot of investment in technology. In fact, if you look at some of the data, in the UAE, an average citizen owns 1.96 mobile phones. So the penetration of technology is definitely not the issue. You definitely have the funding, especially in the GCC countries, and you have the talent from the neighboring countries, Egypt, Jordan, India, Turkey. So you have a nice ecosystem that's ready to deliver value. This is not the time for us to replicate. It is time for us to reinvent. And I think the GCC and the Middle East as a region has that opportunity right now to take a step back and say, how do we actually do a better job of delivering health and care to the individuals? And I think that's the irony of the whole thing. We are in healthcare, but we all have the sense that health and care are both lacking at some level. And I think with the drivers in place, especially with COVID, it's a golden opportunity for us to strike gold. Ali said we've spent $10 trillion annually in healthcare. 30% of that is wasted. Now imagine we have $3 trillion that we now have to re-optimize. And I think that's really where the opportunity is. We have an unmet need. We definitely have the resources. We have under-leveraged technology. And I'll even go a step further. We have under-leveraged data. One of the most data-intensive industries is I think the most inadequate job of leveraging data for better decision-making. So if we can leverage technologies like telehealth and artificial intelligence to really optimize the ecosystem and deliver value by leveraging data and delivering insights, not only to the frontline physician, but the community health worker in Rwanda or the CEO of Mayo Clinic, that is, I think, what success looks like. And at the end, I as a patient would benefit because I'm getting the care that I need when I need it, where I need it. And when you look at just investment in healthcare, we've built a healthcare model around building business class seats for many years, right? We count access in terms of number of hospital beds. Is that really the best measure for us to design and develop healthcare system? So I do think this is a fundamental shift where policymakers, payers, providers are all going to come together and say, let's do this differently. And I think those who do embrace and adopt this opportunity are going to be hugely successful.
Manish and Ali, if I can comment on this. So both of you have been saying that the Middle East has a golden opportunity to reinvent healthcare. However, you see that the decision, so the experts are coming from the West who have implemented this earlier, and the decision makers in the Middle East are kind of stuck on benchmarks and best practice experience. So it's kind of a vicious loop. So you say, no, you have to do new things here. They we say, okay, but the experts are saying otherwise, and the experts from the West are trying to replicate what they know, and so how do you think you can break this cycle?
Shall I go?
Yeah, sure.
I'm very interested to hear what Manish says about the, but I'll go. I think, Yara, you touched on a fundamental problem of, in healthcare, right? Because if you are, imagine a minister of health, right? You have to, by definition, surround yourself with a number of doctor experts, right? Who know what they know, and they will invite you to do basically what they know, right? And in healthcare, we have this thing of evidence-based, right? Which fundamentally it's an evidence based on innovation is almost an oxymoron, right? Because if it's an innovation, there is no evidence until the innovation happens, right? So you have this challenge. I mean, this RFP I just told you about, I was just looking at something. It was asking for a brand new model of healthcare, which is actually very well defined. But then later on, it says applicants should have 3 to 5 years experience of having delivered that. Well, if it's brand new, nobody has delivered it anywhere, right? to the point that you were raising. I think, and if you look at all the companies Matthew just mentioned, that are now the giants of healthcare, giants of technology, Amazon, Google, Microsoft, none of these people had to ask permission from anyone. They basically created a product that the population loved, and they get more and more on it. But imagine if they had to sell to governments. The first Amazon needed to sell to a government as opposed to deliver that. Like, how impossible would it be? So you did put your finger on something really important. And the problem you have is supremacy of capital versus innovation or innovators, right? So while in Silicon Valley, if you have an idea, there are many people chasing to finance your idea, and you have this. I was talking to an entrepreneur the other day. They've raised a few $1 million and have already given vast majority of their business away. Vast majority, right, of their business away for a few $1 million, right? And there is this expectation of capital that if I give you a little money, I have to own most of your business, right? And then I have to sit on your board and I have to tell you what to do, right? And that cultural issue, I think, is a significant problem against the growth of entrepreneurialism in Middle East. And the best so my encouragement to entrepreneurs is look globally for your capital if you can't find what you need locally. But you need to overcome both of those in healthcare. The point that you rightly raised, Yara, about the catch-22 of evidence-based innovation, but also the point about finding a capital that gives people the ability to take rewards from their innovation.
Thank you very much, Ali. Manish, do you have anything to comment on that? Working in the Middle East, and you have.
I agree with Ali 100%. I think the two fundamental things, right? How do you create innovation? And I think one of the things that Matthew mentioned earlier, right? What Silicon Valley has done well is brought top minds and tech companies and VC money into one ecosystem and sort of broken the rules. And how do you replicate that model elsewhere? And I think one of the fundamental things, you have to look at the educational systems. And I really think that right now the competition is for top talent. And that can be a rate limiting step for a startup. Because everybody, look at, for instance, data scientists, right? Everybody is asking for that talent. And there are very few universities producing that. So I think if you're talking to a policymaker, you have to start thinking about what is the problem, not today, in the future, that needs to be solved. And how do I create a sustainable ecosystem that centers on strong educational programs, strong incentives, and really strong drivers for change? Because an entrepreneur needs to see opportunity, and a VC needs to see returns on investment. And an entrepreneur right now should look globally, because right now the risk becomes too high if you're simply looking at it.
Yeah.
Thanks a lot, Manish. I think we're approaching our end of our time. So
yeah, we are. But building on that question, I want to give Ali just one last shot to quickly give us an answer to Engineer Mohammed Noor's question, who's the digital health correspondent of the WHO. here in Egypt, and he's asking something based on Manish is talking about education, and his question is about how can you upskill patients, not necessarily talent, but also patients, to access healthcare services when there's no access to learning services. So in places where education might not be accessible, can this still work?
I mean, fundamentally, the challenge is to make your technology so simple that anybody can access it, right? I mean, when we first started Babylon, that was six years ago. My 14-year-old at the time was 7-8 years old. He was the big tester of our product, because everything we produce, I would put it in front of him on my mobile and say, can you make an appointment with a doctor for me, right? And if he couldn't get there within a few taps, I would go back and say that at that time, we didn't have the kind of verbal technology we have today, right? So anybody can talk. If we can create, create voice technology that can talk to somebody, understand them, and respond to them in voice, anybody can access technology. So the challenge comes back to the technologies, and exactly what Yara said: leave no one behind. That should be the motto. That's why we went to Rwanda. We learned so much from people in Rwanda. And I think that should be the motto for entrepreneurs. Look, I leave you with this. I was born in a middle-class family in my country. I did very well, but then I had to leave. I became a refugee. I suffered from the kind of poverty I don't wish on anybody. I used to be rich. I was being both poor and rich. I've been both young, and I'm much older now. I've been a native and I've been an immigrant, right? But what I saw in my life, it doesn't really matter if you're rich, poor, insider, outsider, young, old. People all over the world have the same desires. They have just different opportunities. Be the agent of bringing that opportunity to everybody, as opposed to getting rich on the ability of a few. And that's what, if entrepreneurs do that, we'll all do very well.
Yeah, definitely. It's very interesting to think at the bottom of the pyramid, and how, again, we can you can build a sustainable business by thinking of people that...
How can you reach the last mile in healthcare?
Yeah, it's a very interesting
it, right, guys? We're reaching. It's not hard. Don't make it sound hard, right? We're doing it in Rwanda. We're doing it in Spain. We serve with the same price the managing director of some of the biggest financial institutions in London, and we serve some of the poorest people in London, right? It's not hard. If you're on Amazon Prime, it doesn't matter if you're rich or poor, you get your delivery through the door, right? I mean, don't make these things sound hard. They are hard, but they are very doable. Just don't take the easy way. Life, by the way, if you take the easy way, you lose as an entrepreneur anyways, because if it's easy, everybody else will copy it, right? So find the hard problem, solve the hard problem. It's much harder for anybody else to get there. And as Matthew was saying earlier, people will throw a lot of stone at you. That's great. Catch the stones that are good, right? And add it to your armory, right? And the ones that are not, let it go, dodge them. But focus on doing really well. We will. There is no question in my head that when we sit here together in a number of years, whether that's 2 years, 10 years, 20 years, doesn't really matter. By the way, somebody's going to quote me and say, he said 2 years, right? I constantly say, I just don't know whether it's 10 years, 20 years, 10 years. It doesn't really matter. What matters is healthcare will soon become accessible, affordable for everybody on earth. Education will at some stage soon become accessible, affordable for everybody on earth. And you and I will leave a legacy behind that can, if you're part of that. Westinghouse, who brought electricity to the United States, used to say, if you want to be famous, go kill a president, assassinate the president. But if you want to make a difference, go make the world a better place than that you find it. Every entrepreneur on this call has the opportunity to leave our community a better place than we found it and we entered it. And there is no reason why we shouldn't. And so I wish everybody a success. When you see an entrepreneur, somebody with an idea, just cheer them up. And to those entrepreneurs, just don't let anybody with any negative feeling to be around you. Even among your friends, negativity, it's just a dreadful thing. Don't let them inhabit you, even in your personal life. Believe in yourself. We will make the world a better place between us, all entrepreneurs. I can't wait to come to Egypt and meet you all, or to wherever you are. But thank you so much.
Ali, thank you.
Generosity with your time and your thoughts, and giving me the opportunity to talk to you tonight.
It has been really, really inspiring and actually motivating. I'm sure a lot of the audience here will agree with it. And there was a lot of interesting ideas, and I have some quotes of it now.
Yeah, and I'd like to add thank you for sharing your story so genuinely and so unfiltered. It's been really inspiring, and this idea of let's not make things sound harder than they are is something that's a very nice takeaway. I think there's no better thought to leave with everyone, but think of it first, and then it will happen.